good evening, good afternoon, good morning to everyone, wherever you are in the world. I'm Dr. Philip Macmillan. I'm based in the United Kingdom, and I've been researching COVID-19 since February 2020. My focus has been on the autoimmune response in COVID-19, and I continue to try and raise awareness that, as my research points out, COVID-19 is a viral mediated autoimmune disease. Within that paradigm, I've said that it's likely, therefore, that long COVID is a persistent viral mediated immune response. And as for the past few months, I've been focusing more and more attention on long COVID. And out of the conference that we have done last week, the Long COVID Coalition Conference, a lot of discussion about the gut microbiome has come up. And it is part of my determination to reach what I call the holy grail of understanding primary pathophysiology. That means you have a full understanding as to where the disease comes from. Within that paradigm, I am talking to as many people as I can. And I have the pleasure today to speak with Rachel Jessey, who is also a nutritionist and naturopath who is in the United Kingdom, and she will be sharing with us some of the work that she has done with regards to the microbiome in the gut. It's wonderful to have you, Rachel. And the first thing I'd ask you to do is to just do a quick introduction of yourself so people know who you are and your background.
Oh, thank you. And thank you so much for having me. It's a real pleasure to come here and talk to you today. So, as you've just explained, we're going to talk about the microbiome and its potential impact on long COVID. And this is something that I've been interested in since the start of the pandemic. So a little bit of background on me. So I've been in clinical practice for 12 years. I'm a naturopath and a nutritionist. And so I've got a good amount of clinical experience of dealing with the gut microbiome. I don't think you can be in this type of profession without looking at that in some depth. So originally my clinical practice attracted quite a large number of complex cases. So chronic fatigue was one of the main things that I was seeing, polypharmacy, looking at the microbiome and also the mitochondria. So that's kind of where my main background was. And that transitioned through to post-sepsis syndrome and then post-COVID syndrome, because I saw that there was quite a big link between those two pathologies. So that's...
I was just going to interrupt you. I was just trying to capture something there as you mentioned that concept of post-sepsis and the microbiome. If you've been doing this for 12 years, Rachel, talking about the microbiome, what was that like early on when you started?
So it was a little bit difficult because people don't really like talking about their digestive health. If you're talking to people on a one-to-one basis, and I remember when I first started in clinical practice and I was so excited to share this information about the gut microbes and healthy bowel movements, and I did a presentation for a corporate client and it just went down like a lead balloon. It was one of the most awkward, awful presentations I'd ever given. And it made me realize when I reflected on that people really don't like to talk about it. So people that are coming to me in my clinic are coming to me specifically for that information. So they're a lot more comfortable talking about it than perhaps the general public are, who don't really understand the interplay and the interconnection between the microbiome and health.
And so what was it that made you interested in this area? Because when we talk about nutrition, we're talking about the gut, but the gut microbiome is like a separate entity into itself. And most nutritionists and so on don't necessarily focus on that. What drove you down this line?
I think it was more to do with the naturopathic element training that I received, because the very nature of naturopathy is about treating the gut and treating the digestion and optimizing absorption of nutrients to ensure that they're going to be getting to the target cells. So it was very much, and even in my very early studies, something that was being focused on. And then I think as I just kind of went into clinical practice, it was just something that I was always mindful of. And when I very first started, the microbiome wasn't getting so much traction in research, but now you can put into PubMed, you put in gut microbiome, you get thousands upon thousands of searches come up now.
But you had a personal experience, didn't you?
Yeah, so obviously I was dealing with the gut microbiome before this experience happened, but my son actually got sepsis, and he was really, really poorly in hospital. He was in hospital for 5 weeks, and when he was finally discharged, he was actually in a very, very poor state of health. So although kind of he was clinically okay and over the sepsis event, he was just so poorly for about a year. So, and I just realized that there was no real help out there with regards to post-sepsis syndrome. So I kind of took to places like Facebook groups and things and found that actually post-sepsis syndrome was quite a big thing, and around 25% of people that suffer with sepsis will go on to have long-term symptoms. And that's when I started looking into the gut, because when someone has gone through a severe sepsis episode, the gut becomes very, very hyperpermeable. And so that can translocate certain bacteria or certain bacteria endotoxins from the gut into the bloodstream, which further kind of perpetuates this issue. But then what I discovered was that even after that septic event, the gut is still very leaky, and it was within my son as well, and he had a very dysregulated gut microbiome as well. So one of the protocols that I started to put in place for him to help with his recovery was microbiome manipulation and healing and repairing the integrity of the gut wall.
Wow, that's tremendous. I hope he's better.
He's absolutely fine now. So yeah, he's doing his athletic training and tennis, and yeah, you wouldn't even know he had it. He's just done brilliantly.
So I want to highlight something because, as I said, I've been looking into more detail at this recently, and here are some of the things that I've come across that when I saw it, it registered to me, and I'm sharing it because I think that people don't think about it. One of them is that you have the stomach, and the stomach then connects to the small intestine, and the small intestine is about 22 feet long, and then the large intestine is about 5 feet long, and the surface area of the small intestine is like that of a tennis court. It's huge. It's a very big surface area. And more importantly, I realized that in a healthy gut, it's largely, I shouldn't say it's not sterile, but the small intestine doesn't really have much bacteria in it. And this changes, however, in the large intestine. What has been your observation as we are now starting to look at long COVID? And I'm trying to understand the patterns of disease. What have you seen with regards to some of those patients you've seen with long COVID and the microbiome?
Okay, so there is a number of factors here because it's very much individualized. So when I talk about dysbiosis, it's a very broad term. It could mean that you have an overgrowth, or you have a propensity to have a more fungal aspect to your gut, or it might be a more pathogenic microbe, or it could just be that you have a lower amount of the commensal bacteria, which are there to kind of protect and support the microbiome. So one of the things that I use quite a lot within my practice is stool testing and breath testing, because you mentioned about the different microbiomes within the small and the large intestine. That's correct. And you have more diversity within the large intestine. But what can happen is some of that bacteria from the large intestine can translate, it can go back into the small intestine and cause something called small intestinal bacterial overgrowth. But you can also get that with the fungal pathogens as well. and they're very hard to detect. So that's why I like to do the breath testing within clinic to see if there's any issues there. So it's really trying to get an idea of what's happening within the gut. Now, the major things that I'm seeing coming back in my clinic is it will be something that's been going on previously with that client. I don't actually think it's something that's being well, there's probably two elements to it, but I think the majority of the people, when I go through their case history, when they've come to me with long COVID, there's been something in their case history that's kind of triggered off this dysregulation within the gut microbiome. So I'm seeing low levels of the commensal bacteria and the butyrate producing bacteria. And what those particular bacteria do is they create lots of energy as metabolites, and they create these short chain fatty acids, and they also help to degrade the mucin products within the gut. So they protect the integrity of the gut wall. And those are the bacteria that I'm seeing are lower in my potential clients. So that's meaning that they have a higher propensity to this hyperpermeability presentation.
Can I pause you on that a minute, Rachel? You are saying that you are finding that these patients have a pre-existing problem that predisposes them to long COVID. Is that about right?
Yes, and that to me is what I'm seeing, because the people that are coming through with long COVID and the symptoms that they're displaying, I'm not seeing that it's like they've been really healthy and everything's been okay. They've had, and suddenly they've got long COVID. It's like, okay, they've had a course of like antibiotics, they've had recurrent UTIs, or they've had recurrent infections, tonsillitis, all these things that can come up, or even stress as well. So people whose metabolism is slightly dysregulated, or blood sugar irregularities, diabetes, all of those presentations that are coming through have a dysregulated gut microbiome that I believe is then putting them at risk of long COVID.
This is an important point, and I keep on going back to my own clinical experience. And as I've been saying to people, is that I'd seen patients years before COVID who clearly had gut-related symptoms,
Yeah.
and they had all kinds of strange presentations. And I found it very difficult to get people to understand that, actually a lot of your symptoms may be driven from your gut, your gut. Why is that so hard for people to see or to get?
I think the reason that's so hard is because the way that we're taught about the human body. So if you have something wrong with your gut, you would go and see a gastroenterologist. If you have something wrong with your skin, you would go and see a dermatologist. If you've got something wrong with your hormones, you go and see an endocrinologist. So no one's actually looking at the body as a whole entity. And so when people get, say, eczema or psoriasis, the last thing on their mind is thinking, oh, it could be something coming from my gut that could be creating this inflammatory response that's kind of triggering the external symptoms. So I think it's because medical care is quite disjointed, and so people have this, they have this connection. Yeah, it's on my skin, so I need to put something on my skin to kind of get rid of it. But again, in my clinical experience, if you look at the gut, you look at the diet, you strengthen the immune system, you're going to be resolving these issues very quickly.
Yeah, this is a very, very important point. And I think one of the things I usually say, again, that I'm not sure if patients understand, is that I say that in terms of an immune response, so as you said, say with psoriasis, this is about an immune response in the skin. You have to have a driver. There has to be something driving the immune system. And I say that, you can get a rash after you've had an infection, but then it resolves in about 3 to 4 weeks because the immune system shuts off. If you have persistent symptoms, and it doesn't matter where it presents, there has to be a driver somewhere. And based on what I'm seeing, the driver seems to almost largely be the gut. How is that so overlooked?
Because there's still so much we don't know about the gut. there's still so much that we're learning about the gut. So we still don't really understand what a healthy microbiome is. We can only go by the research that we have at the moment. So I do think that it's been overlooked because it's kind of like this. It's kind of like an alien entity, isn't it? It's the second part of us as a human. But the other thing that I find really interesting about the gut microbiome is that it's actually, in my research that I've been doing, particularly throughout the pandemic, is that actually it isn't operating as a single entity. It's communicating with the lung microbiome, with the oral microbiome, the kidney. It's communicating, I believe, with the mitochondria as well. So I think actually we are really underestimating the gut microbiome and then the metabolites that are created from those microbiomes. So if our gut bacteria can do that, then viruses and bacteria can do that in our gut as well. I think it would be wrong to think that there couldn't be something going on within the gut as a result of being infected with COVID-19.
There was an incredibly breakthrough concept in our conference last week by Dr. Carlo Brogna from Italy. And they had done research looking at stool samples, and they essentially mixed different stool samples together from healthy and from people who had COVID-19. And what they found was that the viral RNA was increasing through the bacteria. Yes, and it's absolutely incredible. So what it seems is that the virus, once it gets to the small intestine and the large intestine, because there are ACE2 receptors there, so it can replicate in the cells, it also seems to be able to replicate in bacteria. So it has bacteriophage properties. Have you ever seen or come across anything like that?
No, not that I can talk about, probably on mainstream, to be honest with you. No, and not in my clinical experience either. But if that is happening, then the problem is bigger than we probably think at the moment. So this is where we're going to have to really dig deep into probably clinical research and getting people to come together to pull together what we're all finding within clinical practice. Because if the virus is replicating at that rate, then we need to work out how we stop that, how we prevent that replication. The only way that I can hypothesize that you could do that is to strengthen the digestive tract as a whole. So all of the digestive processes, you need to be tapping into the parasympathetic nervous system while you're eating your food, because you have to be relaxed when you're eating to enable the release of the digestive secretions to be able to digest and absorb your food. But also you need to be looking at microbiome manipulation, and that's coming back to traditional ways of eating, which we are so far fetched from, and then looking at what toxins are coming in through our environment that's also affecting the gut microbiome as well. So glyphosates and pesticides and herbicides and all of those other factors. I think, okay, we can have these presentations and we can say, right, okay, these bacteria are low, but we can't just go in with the counteractive bacteria, if that makes sense. We have to strengthen the whole organism, I think, to be able to overcome this. And this is what I'm seeing in clinical practice. If you can get people to really commit to making some really good, dietary and lifestyle changes and potentially supplementation, then it is improving outcomes.
Yeah, this is the big one, because as I said, when I was looking in the research, as you said, with the small intestinal bacterial overgrowth, a healthy gut with a proper mucus layer. So just so people understand, is that in a normal healthy gut, one, there are low levels of bacteria in the small intestine, and two, there's a good protective layer of mucus all through the gut with antibodies, secretory IgA in it. So a healthy gut is well protected. So even if the virus was in a small amount of bacteria and replicating,
Mm.
It would be flushed through the system quite naturally without causing any problems.
Mhm.
If, however, you have damaged gut that is leaky or has a weak mucus layer or has bacterial overgrowth, suddenly the ball game completely changes with regards to risks around longer term infection with COVID-19, because they another study that had come out this year has shown that they have found viral particles up to 210 days post infection.
Yeah, I've seen that one as
You
well.
know, and so it suggests that there is persistent viral replication. I thought it was mostly in the enterocytes, but
Mm.
now with this work from Dr. Brogna, I'm thinking it probably is bacteria then reinfecting the enterocytes, then reinfecting the bacteria, and you have this consistent back and forth that could only happen in a damaged gut. Is
Yes.
that about right?
Yeah, I would say that that could, I mean, we can only hypothesize at this point, but, you know, all we can go by is the clinical experience that we're gaining throughout the course of all of this. And certainly all of the patients that I've seen have had previous issues with their gut, whether that's been related to medications or stress or other factors. So I do believe that that is a very strong correlation between a damaged gut or a breakdown of the mucous membrane and then intestinal hyperpermeability and all of those other factors as well.
One of the other things that I was wondering about is when I was looking at trying to understand this gut microbiome change, because you get a gut microbiome change just from the COVID itself. So
Yes.
from the infection, getting COVID changes the gut microbiome. So I guess my first question, well, what's the mechanism for that? Is it that the virus damages the bacteria, or is it the IgA generated from the infection overlaps with certain strains of bacteria and damages them?
Yeah, it could be either or. And again, I don't think there's any research on that at the moment, is there?
Absolutely. And so this is then that's the first question. And the reason why I thought that was because when I thought about it and I looked at microbiome changes, we also see it in a lot of our chronic inflammatory disease. Fibromyalgia has microbiome changes. Rheumatoid arthritis has microbiome changes. Celiac disease has microbiome changes. And so these are not infective diseases. These are more related to gut-related allergic responses, which produce IgA. So maybe IgA is a big part of this change in the microbiome. If there's an overlap between a bacterial protein and it's targeted by the IgA, that's kind of like what I'm wondering about. Any thoughts?
Yeah, I think that's definitely a plausible thought. And when you're thinking about things like secretory IgA as well and previous stress, and if a body is in a stressed state and the adrenals are overworked, then you can see that people have got low secretory IgA. So there could be a connection between the gut and the adrenals and the stress and the vagus nerve as well. That all interplays with all of that. But yeah, again, secretory IgA is not something that I've delved into in any deep level at this particular stage, because what I see within my clinical practice is that we're just doing stool testing at the moment. We're looking at the gut microbiome. We're seeing what manipulations we can do with diet and lifestyle.
So tell us about any case scenarios that you can discuss with us to see how that
Yeah.
kind without giving any information about
Yeah,
the
so as
patient.
I say, I kind of have a standard protocol that I follow now, in the sense of, I will get first up, when people come to me, it's really important. And I think this goes for any clinician working in the natural health space, is to make sure that they've checked in with their GP, got all the blood work done to make sure that there's no underlying pathology going on before you take them on. And then I will take them through a consultation, and we'll decide whether stool testing is appropriate, which more often than not, I do like to do stool testing so we can see. And also for me, it's helping me to collect important clinical data. And then depending on what's coming up on the stool test, I will then work out what I need to do. So I shared a case on LinkedIn this week about a 14-year-old boy. He'd had long COVID. He was just suffering with fatigue. So that was his kind of main symptom. And we did stool testing on him, and he had low commensals. So it's this low commensals, these low butyrate producing bacteria. Akkermansia was one that particularly that came up, I think, on that one. And we were just able to go in with dietary and lifestyle interventions to kind of help to produce those gut microbes. And I did go in with a probiotic on that one. I don't normally do that as a first intervention, but it worked really, really well for him. So, and it just seemed to correct all of those underlying imbalances. So that was a really simple one. I've then had another client who, she was very complex. So she'd had COVID 3 times, and she actually had her third bout of COVID during our time working together, which was really interesting because we then went in with some other protocols that I used to kind of help with the viral clearance, and that worked beautifully. And actually we did stool testing on her, and it was again these low commensals. There was nothing nasty in her gut. It was low commensals and low butyrate producing bacteria. And I'm finding that consistently with these long COVID patients, and it's been a really interesting thing. So some people are a bit more easy to fix. I think the children are definitely a little bit easier because their guts are less damaged. But yeah, this particular lady, she comes from a long line of chronic fatigue, and so, yeah, she's a little bit more complex. So again, we work on metabolic flexibility, microbiome harmony, and all of those factors.
I want to share with you, this is what Dr. Leo Galland had done in his presentation.
Yeah.
This is what he was finding as well, lower levels, Faecal Bacterium pratsnitzi. Yes, if I've pronounced it correctly. And so, in effect, what you're saying is rather than high levels of this, it's just that this has been depleted, or similar normal good commensals have been depleted in these patients.
And these, I mean, that first one there, I can't ever pronounce this one, unfortunately. I'm sorry. But this one is a butyrate producing bacteria. So it's a really important gut microbe from this perspective. So, I think there is a very big correlation between these commensals and the intestinal permeability, or the breakdown in the microbiome that we're seeing, because the bifido species and the lactobacillus species as well, they all act symbiotically with these gut microbiomes to help feed them as well and give them energy, so that they can grow and proliferate. So it's really about, one of the things that I think about, and a good analogy that I use, is that you need to seed the gut microbiome, you need to feed the gut microbiome, and then you need to kind of look after the gut microbiome. And so the seeding, all of these butyrate producing bacteria will be produced from the fermentation of fibers that you get, dietary fibers from plant fibers. So just introducing those into the diet is a really great thing that people can do to start to work on making sure that these good guys are being produced.
Can you for people who are listening, and when you say these fiber and plant, what exactly do you mean?
So the fibers, so in most plant foods you will get fibers, and they're indigestible. So the body it'll either be insoluble fiber or soluble fiber. And so the body deals with them in different ways. So what happens is when the fibers get into the digestive tract, we used to think they just kind of passed through and helped with bowel movements, but now we know that they're actually becoming a food source for the gut bacteria. So what they do is they basically feed off of the fibers, and then they produce metabolites. So you get bacterial metabolites as a result of the feeding and the breakdown of these fibers within the plant foods. And so they could be short chain fatty acids such as butyrate, but also you're looking at energy. So it produces energy pathology for the rest of the microbiome as well. And also there's components that talk with the immune system as well. So these metabolites are the things that link the brain, the gut-brain axis and the gut-lung axis. So yeah, it's an interesting area. And the fiber foods that you're really looking at, so the foods that I get people to really focus on are the bright, colourful fruits and vegetables, legumes and beans and pulses and chickpeas. They can be introduced. Some people have a little bit of trouble breaking them down. But yeah, definitely going in with the brightly coloured fruits and vegetables is a good start.
That's really, really good, like practical advice. So just encouraging people to eat good amounts of fruit and vegetables. Now, I recently had a discussion with Stephanie Seneff with regards to things like glyphosates and the need for organic based things. So, any thoughts about that? Does it matter if it's organic or non-organic?
I think it's a really difficult one, because organic food's obviously really expensive, and when you're trying to encourage people to eat organic food, yeah, your food bills can start racking up. But it's a really good point about the glyphosates, because again, when I think about what's actually causing this gut damage, is it actually gluten that's the problem, or is it the glyphosates that the gluten has been exposed to that's causing the issues within the gut? So that's kind of one area that I'm looking at. So wherever possible, I encourage people to either buy organic or locally produced. So we're really lucky here in the south coast of England where I live. There's lots of farm shops around, so I can kind of pick and choose where I go and select my fruits and vegetables. I grow my own food as well, so that helps. But there's a really good trick. I don't mind sharing a little tip with you to remove pesticides. So if you can't get things organic, what you can do is you can fill up a bowl, put some bicarbonate of soda in there and apple cider vinegar, and just put your fruit and veg in there, and it lifts off the pesticide residue. And you can see it actually lifting off, because when you actually take the fruit and veg out, you can see a layer of a fatty layer on top of the water. It's not very good. Grapes are the worst ones. They're very dirty.
Really?
Yeah.
No, that is because I love my grapes. So
You
you're,
them.
huh?
Wash your grapes, honestly, they're disgusting.
Oh, so okay, let's go again then, because this is very important for me to go. So you're saying that I need to take the grapes, put them in a container
Put
with
them in a bowl of water, add some apple cider vinegar and some bicarbonate of soda. Make sure they're non-toxic as well.
and how long do you leave it for?
Leave them in normally for about 5 minutes just to soak, and then you need to give them a good rinse. And the apple cider vinegar doesn't make your grapes taste of vinegar, so don't worry. And then you will see when you tip the water out, it's brown. It's like a browny grey colour. It's
No, that is, oh dear, yes, no, and we take these things for granted.
Yeah.
We take these things for granted. How can this change?
Educate. It is just education. It's getting these little tips out, because if you think about what glyphosates do, they're kind of estrogenic, aren't they? They're toxic. There is another chemical burden for our bodies to have to deal with. So yeah, it's just about talking about these things and getting these things out there to people.
No, that is, wow. And does it explain therefore? Because I was recently talking to someone from the Philippines and someone from Pakistan separately, and I was talking to them about the long COVID crisis and so on, and I could see them kind of looking a bit blank. And so I said to them, I said, "Are you guys having lots of cases of long COVID?" And they said no.
Okay.
And that alone made me stop and think, why would other parts of the world who've been exposed to the virus in effect just as much as everyone else not have significant levels of long COVID, and yet in the Western societies we are being absolutely decimated by it?
That's really interesting, isn't it? And so this, I would imagine that it's to do with eating food that you're growing yourself, having a diverse diet, the environment that you're exposed to, so the weather and the sun, and all of those things are going to have a knock-on effect, aren't they? I think with your overall health and gut health in particular. But it's really interesting that in Western societies, we're exposed to more pharmaceuticals, we're exposed to more chemicals, we're exposed to more stress. I think that's another thing that I think people don't really consider, the impact of stress on the gut microbiome as well.
Wow. Listen, that was I'm so taken aback by this with the grapes, because I eat grapes so regularly, and I'm thinking, oh my goodness, all this time I've been ingesting high quantities of pesticides that I could have removed by a simple action. And so yes, I'm going to go and get my back. Does it have to be apple cider vinegar, or could it be white vinegar? Does it matter?
I actually did a TikTok on this, and I had loads of comments, and people had tried it with normal vinegar or white vinegar, and it didn't taste it kind of tainted the taste of the fruits and the vegetables. So I would stick with apple cider vinegar. It's quite benign in taste, that one.
Wow. No, that is a gift for me, at least. If anybody else hears it, I hope it's of value to them. So, as we close out now, Rachel, what would be your takeaway? What would you want if you were able to get in front of all of the scientific people and you wanted to give them a direction or something? What would you say to them?
I would say definitely look at the gut, but look at the person as a whole. It's really important at this stage to get a complete clinical overview of each and every individual. And I know that's really hard, but it's about clean air, clean food, clean water, and those three things in themselves are going to produce a good, healthy microbiome. So I think, just to keep it that simple would be something that I would love to get out there.
Wonderful, wonderful, wonderful. Thank you very much, Rachel. And you are at BeNourished in the UK.
BeNourished, yeah, BeNourished.co.uk if you want to look at my website, but as well, connect up with me on LinkedIn if you want to talk about things further. I'm more than happy to get involved and getting engaged in conversations, because I think we need to all come together now.
Wonderful. Thank you very much, Rachel. I really appreciate this. I hope everyone finds it as fascinating as I did. And let's all look after and protect our gut.
Yes, absolutely. Eat your fruits and veg.
Thank you.
Bye.